Hello, I'm Janelle Reilly, the Chief Executive Officer for CHI Memorial, and today I'd like to share with you a brief update on our local response to the COVID-19 pandemic and the latest in our treatment of those diagnosed. The first COVID-19 patient was diagnosed in Chattanooga on March 13, 2020. On that day, our community joined the world in a fight against a disease we knew little about. A disease that attacks our most vulnerable, and a disease that generates fear, because at the moment, there is no vaccine, no one specific and effective treatment, and it is highly contagious. The attempts to stop the spread of the disease have brought economies to a halt and have impacted everyone in this world, either physically, economically, and for sure, emotionally. As we are about to enter the 6th month of this pandemic, I remain in awe of our healthcare workers who show up every day to do whatever it takes to battle this illness and keep our community and our patients safe. I especially want to recognize those who work behind the scenes and yet are the first line of defense in this fight. Our brave paramedics and emergency medical technicians, our hospitalists, emergency room physicians and staff, and those who are in the ambulatory clinics, urgent care clinics, and staffing our community's testing sites. I'd also like to recognize many of you who are delivering packages and services to our homes, keeping our retail and grocery stores open, providing child care to returning workers, teaching our students, and manufacturing essential supplies. We have been faced with the trial of our times, and together we have risen to meet that challenge. As of this writing, 7,085 people in Hamilton County have been diagnosed with COVID-19, and 75%, or 5,347, have recovered. 63 people, however, have died. Since last May through early August, COVID-19 hospitalizations in Hamilton County and our surrounding counties were on a steady upward trajectory. We experienced a peak on August 3rd with 159 hospitalized patients in our region's 6 health systems, with approximately 35% of those patients needing intensive care. Since our high point, hospitalizations have declined to around 100 in these same 6 health systems. We believe this is strong evidence that the mask ordinance and social distancing measures are contributing to a decline in hospitalizations. Based on our modeling tools, we anticipate a second influx of 6 COVID-19 patients to occur sometime in the September timeframe. Now, these forecasting tools are not precise and are dependent upon the impact of schools reopening, our community's continued adherence to masking and social distancing. Should we all remain focused on reducing the spread of this disease, we are confident patient volumes will not rise to a level that stresses our local healthcare systems. Regardless of the estimates, we believe the hard work we have done as a healthcare community working collaboratively has well prepared us to manage the expected volumes. Together, we continue to plan for additional locations to accommodate hospital overflow, working together to procure needed resources and personnel, collectively sharing creative ideas and analytical tools, and sharing rationale for difficult decisions. As a result, we now have a more sophisticated playbook to aid our efforts should we see a resurgence later in the year or next year, with each health system having solid plans to care for an increase in anticipated volume and more without having to limit medical care for non-COVID patients. We continue to work collaboratively with Erlanger Health System, Park Ridge Health System, Tenova in Cleveland, Hamilton Medical Center, Ray Medical Center, and the county and the city to immediately implement best practices in management of this disease. In the past 6 months, we face some of our toughest challenges. We have swiftly acted to change nearly every process in the hospital: emergency department admission processes, our surgical functions, supply management, and our visitor policy, all to protect patients and our community. At CHI Memorial, we developed a plan for dedicated units to care for patients either under investigation or positive for COVID-19, and have had 70 brave nurses step forward to volunteer for specialized training to serve this population. Even our surgical staff cross-trained for emergency care, employees joined the labor pool to serve where most needed, and ambulatory physicians prepared to serve as emergency and hospital medicine physicians. This was truly an unprecedented example of courage and reinvention to meet the changing community needs. Being an organization focused on continuous improvement and skilled at reinvention has allowed us to be nimble and continue providing patients who do not have COVID with the life-saving medical care and procedures they need. The success of our response has been due primarily to the extraordinary physician and clinical leaders who led every clinical process change, to a decisive incident command leadership who enacted safety measures quickly, and employees who responded with courage, faith, and compassion. Throughout our community, we've seen medical groups redesigning approaches to care for nearly every physician and APC delivering care via telemedicine. This ingenuity came about as the Centers for Medicare and Medicaid and private health insurers such as Aetna, Blue Cross Blue Shield, Cigna, United Healthcare, and others came together to provide coverage for their members and resulted in thousands of patients across the community receiving primary and specialty care in the virtual setting. In recognition of the need for long-term coverage for virtual care, coverage has been extended until April of 2022. With time, we have learned much about this illness, and yet the science is still evolving. We are providing our employees with ongoing education about the virus, the latest therapies, research, and observations from around the world. Our physician leadership panel records information about the virus and shares with their colleagues through YouTube. This continuous education allows our clinicians to be an expert resource for patients and community members. For example, we have learned that it is better to manage COVID patients on high-flow oxygen and avoid placement on a ventilator as long as possible. We've learned much about what is referred to as the viral load, which is the amount of virus carried by an individual. The higher the viral load, the greater the risk of infecting others through what is called virus shedding. Virus is shed by coughing, sneezing, and simply talking, since these actions put virus-carrying droplets into the air. As science has evolved and we have learned how quickly the viral load declines in an infected person, we are better able to define the level of care a patient requires and for what defined period of time. The Centers for Disease Control and Prevention recently released guidance for clinicians and laboratory professionals on rapid antigen testing to detect presence of the virus in people who exhibit symptoms. Our primary care practices are preparing for its use in the ambulatory or the clinic setting, and we believe antigen testing will have applicability within our schools and workplaces. One tragedy of this pandemic is the number of people who have avoided seeking care for serious conditions out of fear of contracting COVID in the hospital or at the doctor's office. We are aware of many instances of people who have died at home from a heart attack or suffered a massive stroke when doctors could have immediately intervened if the individual had sought care. We are also seeing people deferring screenings for breast cancer and colorectal cancer or delaying treatments due to fear of COVID-19. Delays in screening can lead to delays in diagnosis. Dr. Norman Sharpless, the director of the National Cancer Institute, said that modeling predicts an excess of 10,000 deaths from breast cancer and colorectal cancer over the next 10 years because of the pandemic. I want to assure you that hospitals and doctors' offices are safe places, and you should not delay getting medical attention for chronic or emergent conditions or delay your annual wellness exams and screenings. Your safety and the safety of our physicians, nurses, and clinical team always comes first. All of our medical team members who interact with patients wear the appropriate personal protective equipment, otherwise known as PPE, to protect patients and themselves. All staff are screened for symptoms daily, including a temperature check. We have an ongoing universal masking policy, which requires all staff, patients, and visitors to wear a mask within our facilities. Social distancing practices within our operations also remain in effect. To ensure an adequate supply of PPE, we have in place a real-time monitoring of inventory and shipment tracking, which has proven effective in making certain we remain at adequate supply levels. Since COVID-19, we have been particularly cautious about having visitors in our hospitals and clinics. The last thing we would want is to have a visitor who may not be exhibiting COVID-19 symptoms unknowingly spread the virus to others. That's why we initiated limitations on the number of visitors for each patient across our system that will remain in place until we are certain we are well past the pandemic. Of course, exceptions for end-of-life situations are accommodated. In allowing one family member to visit per patient, we realize the importance of emotional support from loved ones to the healing process. CHI Memorial's commitment to a safe and high-quality patient experience isn't just something we talk about. Every day, our physicians and clinical leaders meet in a safety huddle to make certain our operations and protocols follow the latest recommendations from the Centers for Disease Control and Prevention, the Health Department, and other regulatory agencies. Our diligence to quality and safety is one of the reasons CHI Memorial has recently named as the best regional hospital by U.S. News and World Report and has ranked number 2 in the state of Tennessee behind Vanderbilt. As a faith-based community created in the image of Christ and strengthened by the Sisters of Charity of Nazareth, we pledge to relentlessly pursue the highest quality, safest, and most compassionate care for you, your employees, and family members. In closing, I would like to extend my most sincere thank you to our community for your prayers and for your donations of food and needed supplies for our teams on the front lines. Our nurses, physicians, and clinicians feel your love and support each day. While we still have a journey ahead before we return to our normal lives, I know in my heart that we will reach our destination stronger, kinder, and more connected as a society than ever before. Many blessings to each one of you.
Suffering from allergies and asthma in Chattanooga can make it difficult to enjoy the amazing outdoor activities our city has to offer with all members of your family. The experienced, double board certified allergist at Chattanooga Allergy Clinic can identify the allergy and asthma triggers that cause you trouble and create a personalized, state-of-the-art treatment plan. Early treatment can cure allergies, prevent asthma, and provide the relief you need to breathe easy and enjoy our beautiful city.
Chattanooga Allergy Clinic, helping you live life to the fullest.
You okay?
According to the American Heart Association, 80% of Americans feel helpless during life or death situations. Failure to act could result in unnecessary loss of life. But when you do react, you can double or even triple the chances of survival. Help me save lives, one wrap at a time, because a life is the most precious thing on earth.
Life Care Centers of America has been committed to the healthcare needs of our seniors for more than 50 years. Champions live and work here. Life Care Centers of America.
I'm Charles Miller, CEO and owner of Scenic City Neurotherapy and Ketamine Center in Chattanooga, Tennessee. At Scenic City Neurotherapy, we utilize innovative neuroregenerative therapies such as ketamine infusion therapy and TMS in the treatment of mood disorders and neuropathic pain. We've been serving the Chattanooga area since June of 2019, and we're proud to offer these groundbreaking new therapies to our community. Thank you for visiting our booth at the Chattanooga Expo.
As Chattanooga's newest ambulatory infusion center, Precision Healthcare is committed to giving the highest quality of care for infusion and injection patients at prices more favorable than a hospital setting. When you work with Precision, you can expect transparency and professionalism at every step of the way. Our center is clean and up to date, and we have an experienced clinical staff and intake team that make it easy on providers and their patients.
Hi, I'm Mary Catherine Jordan with Precision Healthcare. We're super excited to finally be in the Chattanooga market. Precision's been around for over 20 years, and I've had the privilege to spend time with them over the last 7. So we're looking forward to meeting you in the near future and answering any questions that you guys might have about ambulatory infusions, and we'd love to have an opportunity to meet you all, so come check us out.